Here's a technique that involves placing two liners, one on top of the other. In this case, we're pretty close to the pulp. Should we place calcium hydroxide or glass ionomer? Could we use both? Should we use both? This is called the double liner technique. Here are two reasons for using two liners under a resin-based composite. Placing a glass ionomer over calcium hydroxide protects the calcium hydroxide from acid etching, which causes calcium hydroxide to break down. Here is the second reason for using two liners under a composite. Etched calcium hydroxide releases byproducts which can interfere with the bond strength of the resin adhesive. We know from chemistry that an acid plus a base yields a salt and some water. So not only does the etch break down the calcium hydroxide, the salt that's created can interfere with our bonding agent. So placing a glass ionomer liner on top of a calcium hydroxide liner protects both the calcium hydroxide and the adhesive bond. Should we also use the double liner technique under an amalgam restoration? Maybe. This is not a pulp exposure. I know because I drew it myself. It's the pulp blushing under very thin dentin. So we place a calcium hydroxide liner, and in this case we're going to place amalgam. So we begin to place our amalgam, and as we condense, we have to place a lot of pressure. The calcium hydroxide liner is not bonded to the tooth, and it's not strong enough to hold up to the condensing forces. So it may very well become dislodged and move while we're condensing. So now you work really hard carving beautiful anatomy into your amalgam, and you're thinking, wow, that's a hot amalgam I just placed. I rock. But what you don't realize is that the calcium hydroxide liner that you placed has moved. It's not where you placed it, and it's doing absolutely no good there in the middle of the amalgam. So that's the first reason to use the double liner technique under an amalgam. Placing a glass ionomer over calcium hydroxide bonds it in place and prevents it from being displaced during amalgam condensation. Here's the second reason to use two liners under an amalgam. If the amalgam is not bonded, placing a glass ionomer over the calcium hydroxide seals the area closest to the pulp from microleakage. So if you place a glass ionomer over calcium hydroxide, you are sealing the deepest area and protecting the pulp. And this should also result in less postoperative sensitivity for your patient. Here is a summary of liners under composite resin. The use of non-adhesive liners under a bonded restoration is not recommended. So if we use calcium hydroxide, we want to seal it in with a glass ionomer. Glass ionomers could be used since they are adhesive. For most restorations, an adhesive as a sealer suffices and no liner is needed, especially if the remaining dentinal thickness is 2 millimeters. Calcium hydroxide should not be etched. Etched calcium hydroxide can contaminate bonding agents. So calcium hydroxide should be covered with a less soluble liner like glass ionomer. Calcium hydroxide should be limited to the deepest area to allow for bonding to the rest of the preparation. And here is a summary of liners under an amalgam restoration. Liners are important, especially if the amalgam is not bonded. Traditional formulations of calcium hydroxide tend to dissolve if the cavity is not sealed, so that would be an unbonded amalgam. Calcium hydroxide covered by a glass ionomer liner will give more strength under amalgam condensation and in function in the patient's mouth. Now let's look at a case. This is a deep lesion in a young patient with many deep lesions. Excavation stops short of the pulp You can see the pink color indicating that we are close to the pulp. Now we place a calcium hydroxide liner. Our product in clinic is UltraBlend and it is light cured. After that, we can place a glass ionomer over the calcium hydroxide to seal it in and hold it in place.